Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a general practitioner talking to a patient named Mrs. Ahmed. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Mrs. Ahmed, come in, please. Have a seat.
Thank you, Doctor.
What brings you in today?
Well, I recently had a routine blood test done as part of a general checkup, and the results came back saying I tested positive for hepatitis B. Honestly, I'm a bit shocked because I don't feel sick or anything, but now I'm worried about what this means for me and my family.
I understand how concerning this might be for you, Mrs. Ahmed. Let me explain what this result means and what steps we can take. First, testing positive for hepatitis B means you've been exposed to the hepatitis B virus, which affects the liver. However, testing positive doesn't always mean you have an active infection. There are different phases of the condition. Have you noticed any symptoms like fatigue, abdominal pain, yellowing of the skin or eyes, or dark urine?
No, none of that. I feel completely normal.
That's good to hear. Many people with hepatitis B don't experience any symptoms, especially in the early stages. We'll need to do some follow-up blood tests to determine whether you have an acute infection, which means a recent exposure, or a chronic infection, which could mean you've carried the virus for longer.
Chronic? Does that mean it won't go away?
In some cases, yes. Chronic hepatitis B means the virus stays in your body long-term. However, it doesn't always cause serious problems. Many people with chronic hepatitis B live healthy lives without significant liver damage, but it's important to monitor it closely.
What causes it to become chronic?
It often depends on when the infection was acquired. People infected as adults are more likely to clear the virus on their own. However, when someone is infected as a child, the chances of it becoming chronic are much higher. Do you know if you've ever been vaccinated for hepatitis B?
I don't think so. I grew up overseas, and I don't remember getting a vaccine for it.
That might explain it. Hepatitis B is most commonly transmitted through blood or bodily fluids, such as during childbirth, unprotected sexual contact, or sharing needles. It's also possible to acquire it through certain medical procedures if proper precautions weren't followed.
So, what do I do now?
The first step is to determine whether this is an acute or chronic infection. We'll do a liver function test and a specific viral load test to measure how active the virus is. If it's a chronic infection, we'll regularly monitor your liver health with blood tests and possibly imaging like an ultrasound.
Will I need treatment?
Not everyone with chronic hepatitis B needs treatment. If the virus is inactive or your liver isn't being damaged, we'll simply monitor it. However, if the virus is active and causing damage, antiviral medications can help reduce the viral load and prevent complications like liver damage or cirrhosis.
Is it contagious? I'm worried about my family.
Hepatitis B can be transmitted, but there are ways to protect your family. First, they should all get tested to see if they've been exposed. If they haven't, vaccination can protect them. The vaccine is very effective and safe. If you have a partner, It's also a good idea to use barrier protection like condoms to prevent transmission.
I see. So, vaccination can really help?
Absolutely. The vaccine is highly protective, and it's part of the routine vaccination schedule for children in many countries now. In your case, it's also important to avoid sharing items like razors, toothbrushes, or anything that could come into contact with blood.
That makes sense. What about my diet or lifestyle? Should I change anything?
Maintaining a healthy lifestyle is very important. You should avoid alcohol as it can strain your liver further. A balanced diet, regular exercise, and avoiding unnecessary medications or supplements that could harm the liver are also key.
I'll make sure to follow that. I think I feel a little more at ease now that I understand it better.
I'm glad to hear that. Remember, you're not alone in this. We'll work together to monitor your health and keep everything under control. If you have any more questions or concerns, don't hesitate to reach out.
Thank you, Doctor. I really appreciate your help.
You're welcome. Let's take things step by step. I'll arrange the additional tests, and we'll go from there.
Extract 2, questions 13 to 24. You hear a GP talking to a patient, Mr. Fields. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, come in and have a seat. You must be Mr. Fields. I understand you've come in to discuss a lump you've noticed.
Yes, that's right. I'm a bit worried about it, to be honest. It's been there for a while now, and I thought I should get it checked out.
You've done the right thing by coming in. Let's start by talking about when you first noticed the lump. Where exactly is it? And how long has it been there?
It's on my upper back, just below my shoulder blade. I think I first noticed it about 6 months ago. It didn't really bother me at first, but it feels like it's gotten bigger.
Okay, and does it cause you any pain or discomfort?
Not really. It doesn't hurt when I touch it, and I can't feel it most of the time. But I do think it's growing, and that's what worries me.
I see. Have you noticed any changes in the skin over the lump, like redness or warmth? Or has it started to feel firmer than before?
No, none of that. It's just this soft lump under the skin.
All right. And have you experienced any other symptoms like fatigue, fever, or unexplained weight loss?
No, I feel fine otherwise. It's just the lump that's concerning me.
Understood. Based on what you're describing, it sounds like it could be a lipoma. That's a benign, non-cancerous growth of fatty tissue. They're usually soft, movable under the skin, and painless, just like what you've described.
A lipoma? I've never heard of that. Is it something serious?
No, not at all. Lipomas are very common and typically harmless. They don't usually turn into anything more serious. Most people live with them without any issues. However, if they grow too large or start to cause discomfort, we can discuss options for treatment.
That's a relief to hear. But why do they happen?
That's a good question. The exact cause isn't fully understood, but they often run in families, so there's a genetic component. Sometimes they just develop for no clear reason. They're more common as we age but can occur at any time.
So what should I do about it? Do I need to have it removed?
Not necessarily. If it's not causing you any pain or affecting your movement, we can just monitor it for now. I'll measure its size today so we have a baseline, and we'll keep an eye on it over time. If it grows rapidly, starts to hurt, or causes other problems, we can discuss removal. The procedure is straightforward and involves a minor surgery to remove the lump.
All right. What if it's not a lipoma? Could it be something worse?
That's an understandable concern, but based on what you've described, it fits the characteristics of a lipoma. However, I'll perform an examination to confirm. If I notice anything unusual, such as it being firmer, irregular, or fixed to deeper tissues, I may recommend imaging tests like an ultrasound or a biopsy to rule out other possibilities.
Okay, that makes sense.
Great. Let's take a look now. Once I examine it, I'll be able to give you more clarity. So, I've examined the lump, and it does feel like a typical lipoma. It's soft, mobile, and doesn't seem attached to anything deeper. There's nothing concerning about it at this stage.
That's a relief.
Absolutely. I'll note the size in your records, and we can review it again in 6 months or sooner if you notice any changes. In the meantime, if you ever have questions or concerns about it, don't hesitate to come back in.
Thanks, Doctor. I feel much better about it now.
You're welcome. I'm glad we could put your mind at ease. Let's keep an eye on it, and I'll see you again if needed.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a brief doctor's consultation. Now read the question.
Hello, what brings you in today?
I've been feeling unwell, and the antibiotics I was prescribed last week don't seem to be working.
I see. Did you complete the full course of the antibiotics?
Yes, I did, but the symptoms haven't improved at all.
That's concerning. Sometimes bacteria can become resistant to certain antibiotics. Did you have this kind of infection before?
Yes, a similar one about 6 months ago. I was prescribed antibiotics then as well.
That might explain it. Repeated antibiotic use can sometimes contribute to resistance. We'll need to run some tests to determine the best course of action.
I hope it's nothing serious. I've been really careful about taking the medicine as directed.
That's good to hear. Don't worry, we'll figure out a treatment plan that works for you.
Now look at question 26. You hear a senior doctor providing feedback to a trainee after a simulation exercise. Now read the question.
Your approach to managing a critical situation?
I suppose it means I need to trust my decision-making process more.
Exactly. Especially in simulations like these, we need to act decisively while still considering all the clinical data. That hesitation could have cost valuable time in a real-life scenario.
So, should I prioritize administering treatment faster next time, or should I wait to double-check?
It's about finding the balance. But in this case, acting sooner would have been ideal.
Now look at question 27. You'll hear a physician in the A&E department talking with a patient presenting with abdominal pain. Now read the question.
So, Mr. Benson, you're experiencing pain in your abdomen?
Yes, it's been bothering me for a couple of days. It started off as mild discomfort, but now it's sharp and localized.
Sharp pain that worsened over time. Do you also feel any nausea or changes in your bowel habits?
Yes, I've been feeling a bit nauseous, and I noticed that my bowel movements have been irregular.
I see. Based on your symptoms and the location of the pain in the lower right quadrant, I'm concerned about appendicitis. To confirm, I'll order an ultrasound. In the meantime, I'll start you on intravenous fluids to keep you hydrated.
Okay, thank you.
Now look at question 28. You hear a nurse talking to another nurse about a patient receiving care for severe depression. Now, read the question. John, do you have a minute? I need to talk to you about something.
Sure, what's going on?
I noticed you seemed a bit dismissive toward Mrs. Carter, the patient with severe depression. She's clearly struggling, and it's important that we approach her with empathy and understanding. However, I feel like you're not engaging with her enough to make her feel supported.
I know, but sometimes I just feel like patients like her exaggerate their issues. I mean, if she really wanted to get better, she could pull herself out of it instead of just dwelling on her problems.
John, remember, mental health is as serious as physical health, and people with depression can't just snap out of it. Our role is to provide non-judgmental care and support their recovery, not to question or downplay their experience. Imagine if you were in her position, or if a loved one was struggling with depression, would you want them to feel misunderstood? Now look at question 29. You hear a training session on how supplements can enhance an athlete's performance. Now read the question.
In today's training, we'll explore how supplements can enhance an athlete's performance when used correctly. Supplements like protein powder, creatine, and vitamins can play a pivotal role in supporting athletes' training and recovery. However, it is crucial to understand when and how to use them effectively to avoid over-reliance or potential side effects. Dietitians can assist general practitioners and athletes by conducting a thorough dietary review to determine if supplementation is necessary and appropriate. For instance, let's look at the case of Sarah, a sprinter preparing for a major competition. Sarah wanted to optimize her recovery and muscle strength. So we evaluated her diet to assess if her protein intake met her rigorous training needs. We calculated that she needed an additional 20 grams of protein daily to support muscle repair and recommended incorporating a high-quality protein powder post-workout. Regarding creatine, her natural dietary intake was sufficient, so additional supplementation wasn't necessary. For vitamins, we identified a mild deficiency in vitamin C and advised her to include a supplement for short-term improvement while also increasing her intake of vitamin C-rich foods.
Now look at question 30. You hear a medical professional talking about a memo. Now read the question.
About the introduction of cross-department collaboration programs, and I'm sure you've thought about how this might affect your day-to-day responsibilities. You're probably aware of the potential benefits, such as improved patient outcomes through better communication and resource sharing. That's not up for debate, but I understand there are concerns about how this might impact your existing workflows. I've heard comments about how stretched everyone already feels, with worries about additional meetings or tasks slowing down your routine. Let me assure you, we've developed these programs with your workload in mind. Processes have been streamlined to prevent overlap, and participation will focus only on essential cases where collaboration truly adds value. Furthermore, clear guidelines have been established, detailing which scenarios require input from other departments and how communication should occur. Supervisors will also monitor the implementation to ensure that your core responsibilities remain unaffected.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a presentation by a healthcare professional about innovations in gastrointestinal diagnostics. You now have 90 seconds to read questions.
Hello everyone, and thank you for inviting me today. I'm excited to discuss innovations in the field of gastrointestinal diagnostics, a topic at the intersection of cutting-edge technology and healthcare. Gastrointestinal, or GI diseases, are some of the most prevalent health conditions, affecting millions globally. These range from irritable bowel syndrome, inflammatory bowel disease, and acid reflux to more severe conditions like colorectal cancer. Unfortunately, diagnosing these diseases accurately and efficiently has always been a challenge due to their overlapping symptoms and variability among patients. Advancements in data science, machine learning and personalized medicine, however, are revolutionizing how we diagnose and monitor GI conditions. Let's begin with the traditional challenges. Historically, GI diagnostics have relied on invasive techniques such as endoscopies, colonoscopies and biopsies. While these procedures are effective, they are expensive, time-consuming, and uncomfortable for patients. In recent years, the emergence of non-invasive diagnostic tools has begun to address these limitations. For example, the use of smart sensors and wearable devices is gaining traction. These devices can continuously monitor physiological data, such as pH levels, motility, and gut microbiota activity, providing real-time insights into the patient's condition. A significant breakthrough in this area is the development of ingestible capsules equipped with biosensors. Once swallowed, these capsules travel through the GI tract, collecting data that can be transmitted wirelessly to healthcare providers. Another exciting innovation comes from the field of machine learning (ML). ML algorithms can analyze vast datasets generated from wearable devices and patient records to identify patterns associated with GI disorders. For example, machine learning models can now detect early signs of colorectal cancer by analyzing imaging data more accurately than traditional radiologists. Similarly, algorithms can assess stool sample data to predict diseases like Crohn's or ulcerative colitis, reducing the time to diagnosis and enabling earlier intervention. Let's also talk about personalized medicine. No two patients with GI conditions are exactly alike. Their genetics, lifestyle, and microbiome composition all influence the course of their disease. Personalized medicine uses these factors to develop tailored treatment plans. For instance, researchers are using genetic markers to predict a patient's response to specific treatments, minimizing trial and error approaches that can be both costly and frustrating for patients. Despite these advancements, there are challenges. First, integrating these technologies into routine clinical practice is complex due to cost, infrastructure needs, and data privacy concerns. Additionally, not all patients may benefit equally from these innovations, especially in under-resourced areas where access to technology is limited. In conclusion, innovations like smart sensors, machine learning, and personalized medicine are transforming the GI diagnostics landscape. They promise earlier detection, better disease management, and ultimately improved outcomes for patients. However, addressing the challenges of implementation will be crucial to fully realizing their potential. Now, let's move to the questions.
Extract 2. Questions 37 to 42. You hear a detailed presentation on dermatological diagnostics. Now, read the questions. You now have 90 seconds to read questions.
Good afternoon, everyone. I'm honored to address this gathering of dermatologists and healthcare professionals today. As we all know, dermatological diagnostics have made tremendous strides in recent years, evolving to become one of the most precise and impactful areas of medicine. Yet, as promising as this progress is, it brings with it several challenges that we, as professionals, need to address. One significant issue is accessibility. Advanced diagnostic tools such as dermatoscopes, reflectance confocal microscopy, and AI-powered skin imaging systems are revolutionizing how we approach skin conditions, from common acne to rare skin cancers. However, the cost and availability of these tools can be prohibitive, especially in rural and underserved areas. The reality is that not all clinics or hospitals have the resources to invest in these cutting-edge technologies, leaving many patients reliant on traditional diagnostic methods that might not detect conditions early enough. Another issue is training. Advanced diagnostics require a specific skill set that not all dermatologists or medical professionals possess. For instance, AI-assisted imaging can identify potential melanoma with remarkable accuracy, but interpreting these findings still requires a human expert to validate the diagnosis. This points to the need for widespread training programs to ensure that all healthcare professionals, not just dermatologists, can effectively utilize these tools. Furthermore, there is the challenge of public awareness. Patients often do not understand the importance of seeing a dermatologist for conditions that might seem trivial, like persistent redness or non-healing lesions. Many still rely on over-the-counter treatments or home remedies rather than seeking expert advice. This lack of awareness delays diagnosis and treatment, particularly for conditions like melanoma, where early detection can mean the difference between life and death. Let's take skin cancer as an example. Skin cancer remains one of the most common cancers globally, and early detection is crucial. With tools like dermatoscopes and AI-powered imaging, dermatologists can identify precancerous lesions and melanoma much earlier than before. However, the general public often underestimates the risks of prolonged sun exposure or dismisses changes in their skin as harmless. To address this, public health campaigns emphasizing regular skin checks and the role of dermatologists in early detection are essential. Campaigns like these could help reduce the burden of skin cancer by encouraging people to seek expert evaluation rather than delaying care until their condition worsens. Another example is autoimmune skin diseases, such as psoriasis or lupus. Advances in diagnostic blood tests and genetic profiling now allow us to detect underlying immune dysfunctions linked to these conditions. This helps tailor treatment plans that go beyond topical creams or phototherapy to address systemic inflammation. But these advancements also come with ethical considerations, particularly around genetic testing. which raises concerns about data privacy and potential misuse of information. So, what can we do to ensure that these advanced diagnostic tools become standard practice rather than exceptions? First, as I mentioned earlier, training is critical. We need to develop and expand programs that teach healthcare professionals to integrate new technologies into their daily practice effectively. Second, collaboration is key. By working with researchers, policymakers, and industry leaders, we can push for subsidies or grants to make advanced diagnostic tools more affordable for clinics and hospitals in low-resource settings. Lastly, we need to advocate for dermatology as a cornerstone of public health. Policymakers and the public must understand that dermatological diagnostics are not just about aesthetics or minor skin conditions. They are about life-saving interventions, early detection of systemic diseases, and improving quality of life for millions of people. In closing, I urge each of you to consider how you can contribute to making advanced diagnostics accessible, reliable, and widely understood. Whether it's through education, advocacy, or clinical practice, we all have a role to play in shaping the future of dermatology. Thank you.
That is the end of Part C. You now have 2 minutes to check your answers.